Well, while families gear up for last-minute summer vacations, health officials are urging parents to remain vigilant against COVID and other diseases as kids head back to school. Now, we're joined now live by Dr. Atul Grover, the executive director of the AAMC Research and Action Institute. Doctor, thank you so much for joining us this morning.
Good morning.
Okay, so back to school. It's an exciting time for kids and for parents too, but it's also important for parents to schedule child checkups with the healthcare provider. So let's talk a little bit about COVID. We've seen rates are growing in over 40 states over the course of the summer. I mean, is it safe for young kids to get the COVID vaccine, and should they get it before school starts?
Absolutely, it's safe for them to continue to get the COVID vaccines. And right about the end of August, beginning of September is when we expect to see the newest version of those vaccines to protect against the latest variants, often called the flirt variants, that are sort of subvariants of the Omicron virus strain. But that will probably get you through the winter time. And so if you think ahead a little bit and start making those appointments with your pediatrician or other primary care provider or clinic now, get that around Labor Day, you should be in good shape for starting the school year once you get your books and your backpack and all that.
Yeah, talking about, what families should be considering when it comes to school starting and also vaccination routines. This is something that parents should get in the routine of doing every year.
Yeah, and I think, look, we sort of had this COVID fatigue and talked a lot about COVID vaccination over the last 2 or 3 years. It may have crowded out for us the ongoing need and the recognition that there's a lot of other diseases out there that are preventable that we have great vaccines for, like measles, mumps, rubella, diphtheria, tetanus, flu shots every year. And all of those are the things that we need to make sure our kids are up to date on. Nationally, the rate of immunizations that are completely up to date for kindergartners coming in has dropped from about 95% to 93%. California is kind of in between at 94%, so not terrible, but not where we want to see it. And that means that there's about 750,000 children at increased risk for these diseases going into kindergarten this year.
Yeah, talking about viruses that are common this time of year. When someone gets sick during the summertime, they might assume recently that it's COVID. But what are some of the more common viruses that we're seeing now, specifically looking back to school time?
Well, there is a lot of COVID going on, and we've seen, as you noted, that rise across 40-plus states. The good news for you out in the West Coast is it looks like Hawaii, Oregon, Washington State are beginning to plateau. Hopefully we'll see those go down, and I would imagine California is not far behind. But in addition to COVID, you have standard cold viruses that are circulating. COVID in particular, though, is the one that we're probably most worried about during the summer, both in terms of long-term effects as well as its level of infectiousness to other people. And so having those tests available at home, making sure that if you have COVID, you're wearing a mask, you're isolating to the extent possible, that's a good idea. As we get into winter, respiratory syncytial virus, RSV, the flu, COVID will come back up again. So where appropriate, you want to be talking to your pediatricians about getting those vaccines up to date for your kids and the rest of your family.
Yeah, a great reminder. Dr. Grover, thank you so much for being with us. Well,
Thanks,
for more
Chris.
information on childhood vaccines and what you need to know as your kids get ready to go back to school, check out our website, kcalnews.com, and click Seen on TV.